Hi, my name is Glenn Dunlap. I'm the administrator at Sullivan Park Care Center. People ask me why would I recommend people to come to my nursing home. I would recommend people to come to my nursing home because I hire the best people, the most compassionate people, and the most caring people.
There's a different atmosphere about Sullivan Park Care Center. It's the longevity of the staff, it's the management. A lot of people walk in here and feel like it's just very home-like. They can see the smiling employees, smiling residents.
And it's just like back home with my friends. I have made many friends here since I've been here, and that's very enjoyable because it's so home-like.
The living quality is just like home. It couldn't be any more like home except there's more of it. And the people are friendly.
Our standard of care is about providing empathetic, experienced care to our residents to ensure that they meet their goals.
Sullivan Park Care Center has nurses and NACs that are very nurturing and caring and try to provide a family environment that aids in the rehabilitation process. We take care of rehabilitating injuries such as knee injuries, hip injuries, back injuries, pneumonia. We also manage anticoagulation therapy. We do IVs, wound vacs, and diabetic management. How are you doing, Gloria?
I'm doing just fine this morning, but I could use something for pain.
Okay.
I am a nurse from way back, so I appreciate the care that I do receive from Sullivan Park because it's the kind of care that I would like to give to my patients.
One of the key focuses of our therapy department is to help our residents and new patients reach their therapy goals and be able to discharge to a more independent living situation, whether it's back home or to an assisted living, an adult family home, or even just remaining within our skilled nursing facility. But we do it in a manner knowing that this person wants to be able to reach those goals as fast as possible. Our therapy department works with a variety of different diagnoses that patients present with. A lot of times they have multiple diagnoses, such as congestive heart failure or other cardiac conditions, to be able to get them back on their feet and be able to be more independent again.
The therapists are good. They're very good, and they're easy with you. You know, they don't push you to do something you can't do.
I fell a lot, but they take good care of me. I was going to ride around in my wheelchair and not walk, and one of the therapists said, "You're going to walk," and I walk with a walker.
I am a speech therapist and do therapy for patients that have swallowing deficits, so they have a history of dysphagia or may have a new dysphagia. So they have oral issues or pharyngeal issues, and then we do therapy for communication. If you've had a stroke or have word finding troubles, and for cognition, for memory deficits, and we can also do alternate augmentative communication devices if you need assistance with your communication.
We work with the folks that come in need of some rehab after injury or illness and work on getting them back on their feet and hopefully back to home or their previous living setting. Some of the diagnoses we see would be like a femur fracture, if someone fell and broke their hip, or maybe they had their hip replaced. If they've had any kind of surgery, a lot of cardiac problems or intestinal GI type problems.
The goal here is always just to get them as independent as we can. For a lot of people that means actually getting back to their own home or back to an apartment in a retirement center if that's where they were. For some folks, maybe they came from assisted living. Our goal is to get them back there.
Better? Yeah, a lot better.
The facilities here for therapy include a therapy gym that's shared by physical and occupational therapy, and we've got a mat table, parallel bars, strength equipment. We have an activities of daily living room, which has a kitchen. We can mimic all the things people need to do at home. Laundry room, bathroom set up for handicapped accessibility. We have an outdoor therapy area, which is just a really nice courtyard where we can work on ramps and stairs, uneven terrain of various sorts. And then we do a lot in the patient's rooms to mimic what it would be like at home.
As an occupational therapist, I come to work every day excited about helping people to get back on their feet and dressing themselves, bathing themselves, doing all those things that we do and sometimes take for granted. And so our goal is to try to reach whatever level of independence that person needs in order to get to whatever setting they're trying to get to. We'll do activities throughout the day because people find that doing exercise all day long is no fun. So we try to find other fun and exciting ways to creatively get stronger and have more activity tolerance.
When you come to Sullivan Park, you become part of our family. And I really mean that. You become part of our family. We treat you as part of the family. And I expect my staff to treat you as part of the family. You get the care that you deserve and that you should have.